Here in the United States, really, it's going to be Black people who really should get it first. Here in the United States, really, it's going to be Black people who really should get it first. Here in the United States, really, it's going to be Black people who really should get it first.
Us now is the very first person in this country to receive the Pfizer vaccine post-trial. You saw her there in Tom's report. Registered nurse Sandra Lindsay, a critical care nurse at Long Island Jewish Medical Center in Queens. Thanks so much for joining us tonight.
Here in the United States, really, it's going to be Black people who really should get it first.
Of course, we've seen that skepticism is even greater in the Black community, in part because of our history with the Tuskegee experiment.
The study was only supposed to go on for 6 months, but continued on for 40 years. Why was the Tuskegee study an issue? It was unethical for researchers to conduct the study without the subjects' informed consent. The men had agreed to get examined and treated for their disease, but researchers did not inform them about the study or its true purpose. As a result of the Tuskegee study, many African Americans developed deep mistrust to public health officials and vaccines. In 1997, President Bill Clinton issued a formal apology to the African Americans victims and the rest of the U.S.
Here in the United States, really, it's going to be Black people who really should get it first.
Our history with the Tuskegee experiment. Why did you trust the vaccine enough to go first in this country?
So as a registered nurse, my practice is guided by science. That coupled with what I have seen and witnessed firsthand, and I also know among my community that there is skepticism, as you mentioned, because of the history. So I think it was important for me to get the vaccine, and so that I can be an inspiration to those people who are on the fence or who are skeptics skeptical about taking the vaccine.
Here in the United States, really, it's going to be Black people who really should get it first.
Have you taken the vaccine, sir?
No, I haven't taken it yet. And
here in the United States, really, it's going to be Black people who really should get it first.
Have you taken the vaccine, sir?
No, I haven't taken it yet. And we are having an ethical committee dealing with the question of who is getting it. And given that there are very strict allocation rules that the CDC has voted, we are very sensitive not to cut the queue and have people getting vaccinated before. So still, I think this committee recommends that I will get vaccinated because polls that we have seen said that people will believe much more on this vaccine if the CEO is getting vaccinated. So likely I will get it.
Here in the United States, really, it's going to be Black people who really should get it first.
Public health officials are concerned about millions of Americans who are resistant to taking the vaccine. To address that, some of those officials are shining a light not just on the science behind the shots, but on the scientists who help bring the vaccines to fruition.
When the president paid a visit to the National Institutes of Health last March, the leads at the Vaccine Research Center explained their life-saving mission.
Why shake proteins that will bind?
The key to it, a 34-year-old doctor named Kismikia Corbett.
I was just there telling the task force about the work that we've been doing.
Here in the United States, really, it's going to be Black people who really should get it first.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. There is none higher. DMC, I will inspire. Time for us to trust and not debate. The vaccine, believe it's safe to take. 9 out of 10 people won't get sick. That's 90% effective and legit. This COVID thing is real and it will find you. It's killing our people. Let me remind you. Back in the days, there was polio, smallpox. Back in the days, measles and mumps, man. Back in the days, but because of the vaccines, none of those saved. Vaccines, they work to trigger immunity. 2 shots, we got antibody security. We gotta act now. No need to wait.
Here in the United States, really, it's going to be Black people who really should get it first.